Hi, I'm Durel Williams, registered social worker and EMDR certified therapist with HeartSpring Therapy. And this is HeartSpring Heart to Heart. So yes, I am an EMDR certified therapist. You may be wondering, what is EMDR therapy? Well, EMDR therapy is eye movement desensitization and reprocessing therapy. It uses the brain's adaptive information processing system to reduce distress associated with the cognitive, emotional, and somatic or physical symptoms of trauma. Now, it does this by prompting bilateral stimulation of the brain, sometimes using eye movement. That's movement of the eyes from left to right, or sound in either ear, or taps or buzzers on either side of the body. It simulates rapid eye movement, or REM sleep, during which our brains engage in information processing, organizing and integrating our thoughts and perceptions. Now, it might help if we have a better understanding of what trauma is in order to understand how EMDR is used. You see, trauma in the context of our mental health is a psychological injury resulting from an event or series of events and from which we experience an altered, typically dysfunctional way of thinking, feeling, or behaving. Now, contrary to popular belief, the risk of trauma isn't dependent on the nature or the scale of the event or how bad it was. You see, trauma is actually about how we perceive the experience, the meaning we take away from it. It's really about the narrative that frames our sense of safety, responsibility, or choice. You see, this is why a seemingly innocuous event can sometimes feel more traumatic than another that would more obviously be deemed harmful. So, why do trauma symptoms occur? Well, we are wired for survival. We're designed to thrive. Every experience is stored in memory to help us learn, adapt, and evolve. When threatening events occur, everything about the experience is stored in memory. The sensory features, like what we saw or smelled, heard, and so on, as well as our body's autonomic responses, like our muscles tensing or heart rate increasing. You get the idea. Or perceptions of the experience during or immediately after the event is also stored in memory. As distressing as it sometimes feels, these experiences becoming part of our memory serves a necessary function. It's to help us survive. By immediately recalling the danger that's associated with unpleasant experiences, our brain sets into motion a series of processes that help us feel safe from or cope with danger. That's what we experience as triggers. Sometimes, though, our danger response system works a little too well, and that we've become so efficient in sensing and reacting to danger, we end up having these reactions even when they aren't warranted. In other words, the collection of sensory, perceptive, and autonomic responses hasn't adapted to real time. The past becomes the present. The problem is, if this keeps happening, we can't take in and process new information, new contexts, new realities. We will constantly feel and believe that the danger from our past is happening right this very moment. But it keeps happening because whenever we're activated or triggered, it's hard to engage in rational, logical thinking. It's just how our brains work. So, why EMDR? EMDR helps to reduce the unpleasant and distressing symptoms associated with being triggered, and it reprocesses old experiences while allowing for the integration of new information or new insights that were previously inaccessible due to the distress we often feel when we're triggered. However, it does this more efficiently, tapping into the brain's natural way of processing information, and it does so in a much shorter time frame than it would if one were to simply talk about the experience. Now, the 8-phase protocol of EMDR entails the reprocessing of experiences based on how we perceive our past, present, and future. In treatment, we address past events upon which our present day realities and future outlook are based. In all stages of the process, you are supported with healthy strategies and skills to ensure you're feeling safe, stable, and ready to engage hard memories. Dealing with trauma or any difficult experience is not only hard, it's disruptive. And I know our impulse is to avoid hard things, but it's not a path you have to walk alone. You can experience healing through safe and effective treatment with a qualified and competent therapist. If you would like to book a consultation, you can call 416-688-5274 or book online at heartspringtherapy.ca. I am Durel Williams. Talk soon.